So what is CAM? Imagine, if you will, a continuum with alternative therapies to the far left, complementary medicine in the middle, and integrative medicine on the far right. Starting with the far left, alternative therapies are those things that people use instead of conventional treatment to address their cancer. An example would be someone who declines curative chemotherapy and chooses to use a special diet instead. Only 4 to 6% of people with cancer leave conventional medicine for alternative therapies. In the middle of the continuum, complementary therapies or complementary medicine are those things that people do in addition to conventional medicine to address some aspect of treatment or care. I use the acronym CAM, C-A-M, to mean complementary medicine. An example would be the use of acupuncture for nausea management associated with chemotherapy. The National Center for Complementary and Alternative Medicine in the U.S. has identified 5 major categories of CAM. The first is body-based. Those are examples such as massage and reflexology. The second is mind-body, including meditation, visualization. The third category is biologically based, things like natural health products, herbs, and special diets. The fourth is energy-based, things like Reiki, therapeutic touch, and so on. And the fifth is ancient healing systems, things like traditional Chinese medicine, naturopathic medicine, Ayurvedic medicine, and homeopathy. To the far right of the continuum is integrative medicine. It's a total approach to care that involves the patient's body, mind, and spirit. The complementary medicine piece is not just an add-on to conventional medicine. Rather, it's an integral piece of the greater whole. Generally, most cancer care in Canada does not take this approach yet. We're working on that. So what's the evidence around CAM and cancer? It's been a long-standing belief by many conventional healthcare providers that CAM lacks scientific evidence that it's useful for people with cancer. This belief is being challenged by the ever-increasing body of scientific knowledge for specific CAM therapies. For example, if you take vitamin D, a year ago, if I had asked you whether you were taking vitamin D, very few of you would have raised your hands. Today, I think the story is very different. Last summer, the Canadian Cancer Society began recommending vitamin D as a means of cancer prevention as a result of rigorous reviews and analysis of the evidence on vitamin D to date. So vitamin D has moved from being a complementary therapy where there was little evidence for its effectiveness summarized in the literature, and it's gone to be included in mainstream conventional medicine where there's good evidence for its effectiveness in cancer prevention. An important part of talking with your conventional healthcare provider about CAM is being able to talk about the evidence. That is, what kind of research has actually been done on the CAM therapy you're interested in, and what does the research say? Fortunately, there's more and more research being done and analyzed by academic groups and scientists and practitioners, and recommendations made about CAM and cancer. Just last year, the Society for Integrative Oncology in the U.S. has published the Integrative Oncology Practice Guidelines. It's a report that outlines specific recommendations on a wide variety of CAM therapies that have proven effective in the cancer population. And I'll briefly summarize some of the key recommendations for that report. The first recommendation is that all patients should specifically be asked about the use of CAM and given guidance about the advantages and disadvantages of CAM in an open, evidence-based, and patient-centered manner by qualified personnel. So there's direction to conventional healthcare providers that they should be talking to patients about CAM, and that you, as recipients of healthcare, are entitled to receive this service. There's recommendations around meditation and visualization as very effective to reduce anxiety, mood disturbance, and chronic pain. Excellent evidence for the use of massage therapy for anxiety and for pain. A huge body of evidence around acupuncture recommended for pain, dry mouth, nausea and vomiting, stopping smoking, shortness of breath, and fatigue, with a caution for use of acupuncture in patients with bleeding tendencies. There's a recommendation around the use of dietary supplements in particular herbal products, to look at the side effects and potential interaction with the chemotherapy drugs and radiation that they're on. They suggest treating herbal products as you would any other drug or over-the-counter product to look at the interaction. And if there's any concern or any inkling that there may be some interaction with chemotherapy, radiation, or surgery, to avoid using those products during that conventional treatment. And for patients who choose to decline chemotherapy or the chemotherapy stops working for them, if patients want to go on and try some CAM agents, botanical agents, they should be used only in the context of a clinical trial, so that a conventional healthcare provider can in fact be monitoring the effects, side effects, and monitoring your health. And in a minute I'll give you a website where you can actually look up current clinical trials for CAM therapies. So in summary about the evidence, there's really good scientific evidence that there's certain CAM therapies that are indeed effective in the cancer experience. Despite this ever-increasing evidence for the use of CAM in cancer, our research has told us that it remains difficult for many people to talk to their conventional cancer care provider about CAM. Patients have told us that they have felt shut down or made to feel silly for talking about CAM. And we do understand that conventional healthcare providers just simply may not have the knowledge or the time or know where to refer patients to receive the support for decision-making that they really need. So then how do you approach your oncology healthcare provider so that they can hear you, so that they can hear about your need and desire to use CAM safely and effectively during your cancer experience? The first step is to remember that you have a right to receive help with your CAM decisions. The recommendations from the practice guidelines say that you do. And remember that oncology healthcare providers generally want to know, if only from a safety point of view, what kind of CAM therapies that you're doing, so that they can in fact monitor the effect of those CAM therapies on your conventional treatment. A strategy that might be helpful before you talk to your healthcare provider is to do a little bit of homework. If you're considering a CAM therapy, there's some key questions you might want to work through and have some idea about before you talk to your conventional healthcare provider. The first question is to consider the goal of the therapy. What is the goal? You want to be careful about therapies that actually claim to cure. If they claim to cure, probably there's not the evidence to support that if you actually delve into the literature. Consider the goal of the therapy beyond the physiological. You may want to be looking at emotional and spiritual goals, and they're just as important as the physiologic goals. What's the safe dose of the CAM therapy? Often that's hard to establish for things like herbs. I was just at a Chinese health food store with a friend getting some herbs, and the scoop that was in her hand of herbs probably was really hard to determine what the dose actually was and what would be safe. What are the risks and benefits? You may want to look at and consider from your own perspective about a CAM therapy that has secondary side effects. For example, you may be taking something to manage your nausea and vomiting, but it may also have the potential to cause other side effects. And you want to look at what is your risk-benefit ratio that you're comfortable with. You want to consider what are the costs associated with this therapy. Right away when we talk about CAM, we can think about financial costs. You may want to think about the emotional and time costs associated with using a therapy as well. What are your values? Ultimately, you want to look at how does this therapy interact with other treatments. There's some really good databases that you and your pharmacist can use to look at interactions with conventional treatment, and I'll mention those in a minute.